So the final person to reflect for this panel is Dr. Carl Allamby. I've seen interviews on NPR and on CBS Sunday Morning, and then got a chance to meet him, and I met a man that is hardworking and humble, who's practical, and I love practical people. After being a mechanic and having his own car shop, then made a transition mid-career, which I wouldn't have the courage to do, but went mid-career, went back and got medical school training, and we have a couple of people, medical students in the audience from Ohio University Medical School, just to let you know that, and then did a residency in emergency medicine at the Cleveland Clinic, and is currently practicing in an emergency room, but also practiced as a mechanic when people are pretty stressed. You know, when your car breaks down, that's a crisis. So, so as you can see, we've picked people to talk about places where you find crisis, and he picked careers in two places where people are under crisis. So I'm really interested in hearing what your observations are.
Thank you. All right, thanks for having me here today. Actually, Judge Dawson, I grew up in East Cleveland, right on Knowles Avenue, and had my first automotive shop in East Cleveland, by the way, Allamby's Auto Service, which was there for about 17 years, and had another business that was in South Euclid as well, too, and decided to make this important career change into medicine, where I'm now an emergency medicine physician. And ironically, I do see a lot of people in crisis that are similar to what I saw when the car broke down. If any of you could imagine on your drive here today, if the car broke down, you'd be pretty darn stressed. And we may have to give you some mental counseling when you get here. So if you're having car trouble, just let me know. So I'm so happy to be able to share my experiences here and my ideas on how to make mental health care more equitable and attainable for the people of our communities. I think we can agree that the ill effects of poor mental health crosses all boundaries, whether you're wealthy, middle income, poor, men, women, no matter where you've come from. Access to appropriate mental health care is even more important now during this era of COVID. I've seen a lot of disastrous consequences from some of the mental health situations that people have found themselves over these past few years. And we've had to kind of isolate ourselves out of a necessity for us to just all survive. So although the prevalence of COVID has waned, the ill effects of this disease has exacerbated mental health and the crisis that we face in this country. From my own experience in the emergency department, we're challenged to address varying illnesses. Oftentimes, life hangs in a balance, and seconds and split-second decisions could mean the difference between life or death. Other times, I'm faced with minor illnesses. Sometimes they aren't things that would lead to dire consequences, but still, it's an emergency for that person. However, we are sometimes faced with psychiatric illnesses, and there's no clear medical indication to act expediently in order to save somebody's life or limb. And these could be some of the most distressing cases. I've seen people come to the emergency department voluntarily. Sometimes they're brought in by family members or other loved ones. Sometimes they're brought in the police or by EMS squads. And this is usually when they're brought in against their will. Either way, it could be distressing for the patients and for the people in the hospital. If a person is violent, sorry, I skipped ahead here on something. If somebody is violent or threatening, sometimes we have to put them in restraints. We have to medically sedate them in order to gain their cooperation and make it safe for us and to make it safe for them and the treatment that they need to have. This patient is placed in a room where a medical exam is done. We take blood, we take urine, and we screen them in order to make sure that they're what we call medically cleared in order for assessment. It's hard to send somebody to a psychiatric facility if they also have a lot of medical problems that need to be addressed at the same time. Now, if a patient is nonviolent, an inquiry is performed to assess the level of capacity a person may have, and if they're a threat to themselves or society. If deemed to require hospitalization voluntarily or sometimes involuntarily, where we have to pink slip somebody, and this is where I have to make the decision that you're not safe to go back out on the streets and be in society. So I essentially have to take your freedom away to leave at that moment until you have proper psychiatric evaluation. And we do this, and we have to keep them in the emergency department until we find an appropriate place to send them for their psychiatric evaluations. Now, sometimes this system works well and very efficiently. Other times it's very cumbersome. Our lack of mental health resources and the lack of facilities to be able to appropriately care for the number of people needing psychiatric care can put a strain on ERs that are already overburdened. Sometimes we're dealing with enormous responsibilities and a lot of challenges that, as Judge Dawson said, that are completely unexpected. I walk into the emergency department and I literally don't know what I'm going to deal with during that day. If I'm going to have people who are hanging on by a thread for life, or is it going to be an easier day where I'm treating much less dire circumstances? But sometimes these mentally unstable people, they could come in acutely psychotic, severely depressed, suicidal, homicidal. And a lot of times what makes it so distressing is that they have to wait for hours, sometimes even days, where they sit in our emergency department waiting for a place to become available where they could be transferred to. So for someone on the edge, how do you think it would feel to be locked in a cold, small room? Only a thin gown on. It's really thin. There's no contact to the outside world, and you're watched. Every moment, every movement is watched by somebody, even if you have to go to the bathroom. So we have to make sure that you're mentally okay, that you're not going to go into a bathroom and hang yourself, or how some people try to choke themselves with some of the rails that are on the bed. It could be really distressing. But anyway, in the condition that we have to keep these people in sometimes, it's demoralizing, demeaning, degrading for those who come to us for care. And these people a lot of times are very psychologically fragile. And for those who voluntarily admit to come to the hospital for psychiatric care, what is the rationale that they could use to ever count on us again if we treat them poorly, if their first experience is so unpleasant? So after being screened by a behavioral health specialist, the behavioral health specialist will sometimes tell us that people don't qualify for mental health care at that time, that their symptoms don't seem to be so severe, and they could go home and deal with that. And so what I have is a packet that I'm supposed to give to people. And I have this packet here of papers that I usually go and I scrounge out of a desk and I put some things together, and I bring this to my patient and I say, here goes some resources for you to call one of these places. There's multiple places on here. Call any one of them. See if you could get the help that you need. So let me ask you, how would you feel if you're on the edge? You could barely cope. You're dealing with stressors that brought you here today that are very distressing, only to be handed a packet of papers and saying, here, try calling one of these places and see what they could do. I imagine that you're there and people who are dealing with mental health crisis, a lot of times they don't have a lot of resources. And now I hand them this packet of papers where they're supposed to call people, a list, one by one. And a lot of these places don't have the capacity to care for the people who are calling them. And again, they deal with this of, being rejected by these mental health facilities. There's nothing that really coordinates all of these services in order to bring them together for people in a very succinct manner. Instead, I give them this list, and sometimes I feel like it's a slap in the face. But I know that this is the reality that a lot of my patients face, that I'm going to send them out of there without the help that they need. And maybe they're going to end up in Judge Dawson's court. Or maybe they're going to come back on a slab because they've done the ultimate and have hurt themselves. Or sometimes I see suicides and homicides that coming together, love-hate crimes. It's very distressing, and we deal with a lot. So I appreciate you all allowing me to give you a glimpse of what I face in the emergency department. It's not just, shootings or stabbings or car accidents or heart attacks or strokes or limbs that are halfway hanging off, or I could go on and on. But I know we have lunch to eat later on, so I don't want to give too many bad visions here. But my question is, ER doctors do not have good resources to connect patients whose mental health crises are not severe enough to need acute intervention. So what efficient and realistic process should ER doctors have across the city to help people who need mental health resources, but who are not sick enough to be admitted to the hospital? And I know that question's been up there for a while, so you all have had ample time to answer that. So I'm hoping for some good responses. And you could take these questions, all these questions that have been asked, and ponder on those and come up with some good ideas throughout the day. And I'm sure that there's a lot of good answers and a lot of brilliant minds out there who have put things together. I know that there's a lot of psychiatric services that already exist, and there are a lot of people doing hard, good work towards mental health care. And I appreciate all of you for the work that you do so far. But as we all know, no matter how much we give, there's always more that we can do and more that we need to do. So thanks for having me here today.
So we'll make sure that Dr. Allamby gets all those responses, that as he was talking, we're scrolling through some great ideas. And it does seem like among emergency departments, we need to do better than simply having that list. Because I know when I call places, often I get voicemail, or they're not accepting people, or here's one place where we could do a little better and do something differently. The other thing that when I talked to Dr. Allamby in creating this panel, he said something like that he did more hand-holding as a mechanic than even as an emergency room doctor providing mental health support. And I thought that was really striking and made sense once he said it. But having a caring and compassionate community member as a mechanic may help my mental health more than even an emergency room doctor in those cases. So thank you in both respects.